I had some hormone shifting, and I was looking for help because where I live there wasn't much for primary care that specialized in any of that. And I went to multiple doctors between my primary and then OBGYNs, and they couldn't see eye to eye, and the treatment was different depending on who I went to. So I was just looking for more of a comprehensive approach and whole body care like treatment.
You kind of referenced this before. What specifically had you tried before, and what exactly wasn't working?
So I've been on hormones, like hormone patches and progesterone, and the dose, and it just was not correct. So just trying to balance those hormones. Also, like my gut health wasn't great. I came here seeking help with that as well, because the gut is like the second brain. With treatment with Dr. Sasha Rose, like my gut is much better than it was, practically healed really, and I just appreciate something different, the approach, rather than giving you like Pepsid or stomach medications that you would get prescribed from the doctor. She went with more of a natural approach that I appreciated, and that worked. So
very good. And what made you choose our clinic?
Yep. So I just did some research, and you guys had some really good reviews, and I just like the approach that you have for the patients. Very open, honest approach, and willing to try different things, different type of care.
And before you started with us, day to day, what was life like? Work life, like sleep, energy, training, mood.
Right.
Anything.
So I'm busy. I work a couple jobs. I also have 4 children. So just with my hormones where they were at, and I wasn't getting much sleep. So waking up exhausted all the time. My stomach never felt really well. Just kind of bloated, and just that wasn't digesting like it should have been. So just feeling overall fatigue, even if you sleep. Just waking up still tired and exhausted. So
nice.
Yeah.
And what were you most frustrated with, worried about at the time?
I was just mostly frustrated with, the care I was getting, just trying to be an advocate for myself, and going to the different providers and like telling them like something's wrong, like I don't feel well, like, and they just wouldn't listen. So that's why I kind of looked for different care like down here, because I knew that you guys offered that.
What was your first visit like?
Yeah, my first visit was, was excellent. It was very comprehensive, got all the blood work done, the first initial assessment, and kind of seeing where I stood was really good.
What specifically felt different about our approach compared to past experiences?
Yep, so just kind of being treated like a whole person. I've went to other providers where, they specialize in this and specialize in that. Just seeing somebody as a whole person, and like treating them like that's what they are, and every system of your body affects another system, plays a part. So that was, helpful that you guys just kind of look at everybody as like a whole person and treat you like the same.
What, if any, changes did you notice personally, like first?
Personally, after I started the treatments that she had prescribed, like I started sleeping a little better. My stomach felt a little better as well. So it kind of progressed as I continued the treatment. My stomach, now I'm off the medication that she had prescribed. It was just like 6 weeks, I think I took it, and it made my stomach feel so much better. And even now, I'm sleeping much better. I'm just going to bed a little bit earlier, trying to get, rest, and feel much better than I did, for sure.
What is something you can do now that you couldn't do before?
I guess just kind of looking at everything with the way that she prescribed different things and different approaches. It's kind of opened doors to different types of healthcare. That's beneficial, I think.
What are 2 to 3 specific wins that you're proud of?
Yep. So balancing my hormones, and like just with the rest, sleeping, feeling better in your own body,
And what does a good day look like now compared to before?
Yep. So a good day, like I said, I go to bed early, 8:30. I wake up like 4:30, 5 o'clock. I usually walk a couple miles on the treadmill, and like just kind of plan my day around, staying productive and healthy, drinking lots of water, and just making good choices.
Got it.
Yeah.
How did you feel listened to or taken seriously? Like, what let you know that Dr. Rose was listening to you and or taking what you were saying serious?
Yeah, so when I had my visit with her, just like good eye contact, she would let me talk, she would listen, and then she would respond when I was done. Just the communication was very good, and her response and explanation of, what was going on was very thorough and answered all my questions.
Got it.
Yeah.
Who would you recommend this to and why?
Yeah, so I'd recommend to anybody that is looking for care that is, a different approach, more comprehensive, somebody that's looking for answers that they can't get from their regular primary doctors, and people that are tired of just going from one place to the next and, being treated, poorly or not thorough in their assessment, and diagnosis. So.
And if someone is on the fence about starting, what would you tell them?
Yeah, I would say go for it. What do you have to lose? You want to feel better? Do it.
And if you could go back, what would you tell your past self before starting?
Yeah, so I would have probably started it sooner, but you have to you don't know about something you don't know about, so I would have probably came earlier. Yeah.
Got it.
Yep.
Anything else that you would just care to add?
Nope.
No? All right.
I think I've said everything.
Yeah. Thank you so much
You're
for
welcome.
sitting down with us. That
Yeah.
was wonderful.
Thank you.